welcome to Research That Matters. My name is Rochelle Morris. I'm a Gumbaynggirr woman from the north coast of New South Wales. I would like to acknowledge and pay respect to the traditional owners of the land on which we meet today. It is upon their ancestral lands that we gather here today. As we share our knowledge, teaching, learning and research practices within our universities, may we also pay respect to the knowledge embedded forever within the Aboriginal custodianship of country. Thank you.
Welcome, kia ora. Welcome to the Adelaide campus today, where we will have 2 hours looking at our researchers in the research that matters. Thank you, Rochelle, for our acknowledgement of country, a very important part of beginning this session. Welcome staff, students, PhD students and some of our future students, guests and friends. I'm Professor Justin Beilby, the Deputy Vice-Chancellor Research.
And I am Dr. Louise Townsin, Manager of the Research Office. Today's Research That Matters broadcast is important because we want to elevate the work of our researchers. Across Torrens University, Media Design School and Think Education, our very talented researchers are building and creating research programs that are really making a difference in people's lives. They're making new knowledge that will inform not only our lives, but also the lives of future generations to come.
Research that matters is about raising the bar, letting everyone know across Australia and New Zealand, from Torrens, Think and the Media Design School, where we're making a difference in our areas of research. We've challenged the researchers to present their findings in 5 minutes, how they're working in interdisciplinary teams, and how they're making a difference to the questions they're asking. We are building these conversations in 4 areas that we will build for the future across Australia and New Zealand. Societies in drastic change, people and industry for impact, building health solutions, and security and sustainability. We will walk away in the next couple of hours with a shared understanding of how we're making a difference in these 4 areas. We've also got a number of surprises through the presentations, which will make you all smile and laugh as we go along. So this is about enjoying our research and moving it forward.
I love surprises, Justin. I just can't wait. And I'm so excited to hear more about our researchers as they really explain to us how their work is making a difference and why it matters.
I'd like to now ask our Vice-Chancellor, Professor Alwyn Louw, to present his perspective on why this is such a crucial part of our future as we go forward in the research that matters.
The core business of higher education is to facilitate effective learning. Now that transcends all forms of learning. And if we understand that, then we would also accept the fact that the responsibility of higher education is to continuously look at those areas where we require more knowledge, new explanations, or problem solving. It is therefore our responsibility to continuously have an agenda, activities, and capacity that ask the right questions, that analyze specific problems, interpret them, and recommend specific solutions based on our understanding of theory or our understanding of relationships that we may find. This knowledge forms the basis for our curriculum, in other words, what we teach our students, the basis we use to engage with our partners in government, in industry, the basis through which we create engagement and relationships with our communities to ensure that we make a contribution. Therefore, research is at the core of our ability to conduct the core business of effective higher education. I'm therefore extremely excited about this day where we can share ideas and listen to our researchers and see how far we've come on the way to prove the relationship between science, technology, and society. Thank you, Justin.
Thank you, Alwyn. And I think Louise and I are just as excited as you are. So let's kick off. And our first theme is around building health solutions. This theme has always been very important to Torrens and to me personally, as many of you know, my background is medicine. We have a growing and important track record in research focused on prevention, the management of chronic illness, and the issue of wellbeing for people across societies. For example, our world-renowned Public Health Information Development Unit, FIDU, is delivering outstanding research, social atlases, information that inform policy and public health interventions. This theme, building health solutions, clearly matters to communities, societies, peoples, our lives, all of us basically, in how we live our lives into the future. The future that we're building is providing evidence-based, new knowledge, looking at disease trends and risk factors, and developing new public health interventions to test in different communities. We are creating solutions for patterns of care and looking at how we use our dwindling health resources in a much more efficient manner. Our first researcher I have much pleasure introducing is Professor Simon Stewart, National Health and Medical Research Senior Research Fellow based in Adelaide. Simon is a cardiovascular nurse scientist, a health system researcher who's been working with chronic illnesses across the globe. He's going to present some influential work that he's doing in Africa and how the role of local health services can shape future care in one particular country in Africa. Over to you, Simon.
Well, thank you for that introduction. It's my absolute pleasure to talk to you about the work we're doing in Africa. I traveled to Africa firstly 20 years ago. I had an invitation to visit to South Africa, and particularly Soweto, which is a township southwest of Johannesburg, one of the main cities there. And I met with this wonderful lady and her team, Professor Karen Louw. So Professor Karen Louw was a cardiologist in the world's largest hospital at the time, the 2,500 bed Baragwanath Hospital. And after discovering that there were many diseases, many 1 in a million cases that seemed to be more common than I expected, and a large burden of disease, we designed the Heart of Soweto study. Now, the Heart of Soweto study was designed to understand what were the antecedents, the risk factors, and the burden of disease in that world-famous population. So we went from the taxi rank of Baragwanath, where 1 million people traveled through per week under the watchful eyes of the old cooling towers of the power station there, to primary care clinics where nurses were dealing with 400 odd patients a day, to the hospital to determine what was the burden of disease there in Soweto. And this is what we found. We found that there was a combination of what we call a crossroads of historical disease of poverty, in the impoverishment of malnutrition and infectious diseases, were now mixing with the new lifestyles of urban living in this African population. And what was that doing? Well, that was damaging their hearts, that was damaging their lungs, and they're connected, obviously. But what we found was there was more women affected than traditionally in the outside world, that there were actually younger people affected by this. And so both the current and the future threat from this, what we call cardiopulmonary disease, this combination of heart and lung disease, along with the infectious milieu of HIV, AIDS, and malaria and TB, was really harmful to the population. So this led us to a wider collaboration, the Heart of Africa collaboration, and many wonderful people I've met through the Pan-African Cardiac Society. We were able to publish our results in the Lancet and other top journals, but also interest other African groups to understand what was happening in their own countries. And so from Nigeria to Cameroon to other parts of Africa, other studies and collaborators we worked with really revealed the true heart of Africa. And this is important. So I was fortunate, and I still managed to work with many wonderful collaborators around Africa who are really dedicated to this idea of what is the unique burden of disease in Africa, and what can we do to stop this. So this pandemic now of COVID-19, for example, will have a devastating impact on the heart and lung health of Africans, and we're working together to try and understand that. But from my own point of view, I've been concentrating now on a country called Mozambique, which is just north of South Africa, and a wonderful lady and her team, Professor Anna Makumbi. She's a pediatrician, a cardiologist, and a wonderful leader for our country. So along with her team, we've recently completed a study called Mozart. And Mozart was understanding the burden of emergency presentations in both the rural and urban areas of Mozambique, and of more than 8,000 people presenting to emergency departments in the southern, central and northern part of Mozambique. We found that this problem of cardiopulmonary disease goes from infants to adults. And so Mozambique's in a different stage than what we found in Soweto, and it's potentially, we can actually prevent progression to more established disease. But here's the problem. Many of the households remain extremely poor. Many of the households are using wood and charcoal to cook and heat their rooms. Many of the people there don't have running water, and so infectious diseases, the pollution, and even the climate has an impact on their heart and lung health, this cardiopulmonary milieu. So we've developed a collaboration. It's interdisciplinary, so we're using cardiologists, pulmonologists, epidemiologists, any sort of issue you can think of, and with satellite technology, we're conducting the Search Africa project. And this is looking at from the environmental to the individual factors that promote poor health, heart-lung health in the Mozambique population, and creating interventions to prevent that. So this is research that matters. This is the heart of what we do, and I'm privileged to work with my friends and colleagues in Africa, and you should be too, because we are making a difference, and this will have a profound effect on the people we are studying. Thank you so much.
Thank you, Simon. And now we've got you live. Thank you for your very thought-provoking and really, really interesting summary of your research. I'm going to hand over to Louise to ask the first question.
Thank you. And hi, Simon. It's really lovely to see you. My question is around your collaboration and how you've been able to keep your research momentum during COVID when many of the people you work with are on the other side of the world. So could you tell us a little bit about how you've been managing that?
Thanks, Justin. Thanks, Louise. We live in challenging times, obviously, with COVID-19, so we have interactive technology to talk to each other on Zoom and other platforms, but you can imagine there's very many early mornings and late nights talking. The important part is we've established the connections with people, so when we do talk, we understand each other's environment and what we're talking about. So you can't create new connections, but you can certainly maintain old connections, firm connections and collaborations with those people through this technology. So challenging, but we will get through, and we'll carry on.
So my question sort of builds off the back of that, Simon, is the importance of your research network, especially international research from a different culture and different health systems perspective, how it's influencing your results and how we can cross-fertilise across the world as we look to manage our chronic illnesses and our cardiopulmonary disease with different perspectives. So just for example, just give us some understanding of how that cross-cultural, cross-system perspective can be so creative as we look for solutions.
Sure, Justin, and thank you, because I think this is a critical issue. Humanity is common to all of us, but we do have different cultures in the way we handle our health and illness, in how we value different things. And so I learn every day from my collaborators, and they certainly learn from me, how to approach problems and solutions in different ways. So this cross-fertilization, if you like, both interdisciplinary and from people from different cultures and backgrounds, is essential. That's what makes us human. That's interaction, and communication is so important. So we have a very open communication levels to explain to each other how we understand a particular problem. But importantly for us, when we go to Africa, we ask questions and learn from, rather than saying we've got the solution. It's really important, and it's worked really well for us.
Thank you, Simon. We really appreciate the impact of your work and the part that you have in Torrens' research future, and we'll do everything to support you as you move forward together. That was our Senior Principal Research Fellow, Professor Simon Stewart, who has joined us live from Adelaide. Louise, what a fantastic start.
I know.
Global, here for good, cultural involvement, team-based care. It's a really good place to start. Louise, who's next?
Well, I'm really, really pleased to be able to introduce our next speaker, my very dear colleague, Dr. Rachel Ambegshir. So Rachel and I have quite a long history. In the early days at this university, it's been such a pleasure to see Rachel succeed. And Justin, Rachel was also your PhD student, so I know you're pretty proud too, yes?
Very much so.
Great. Well, Rachel is now a research fellow here at Torrens University, Australia, and we're going to hear about her research into a very increasingly common condition and how her research is managing to create new models of care for this condition, which is frailty. Can't wait to hear Rachel. Thank you.
Thanks for that introduction. So frailty is one of those conditions that a lot of people make assumptions about. If I ask you to think of a typical idea of a frail person, you might describe to me someone who is older, stooped over, perhaps walking with a cane, thin, a whole range of those kind of stereotypes. And so along with that comes this idea that frailty is almost inevitable as we age. It's almost a life sentence in some people's perspectives. And it's really this idea that frailty is something that we can't do anything about. So in reality, over the last 2 decades, emerging research has started to show that frailty actually is potentially reversible and it is potentially treatable. It's a dynamic condition that people move in and out of, and it's not something that has to stay that way or necessarily become worse. And so with the right intervention and at the appropriate time, it's potentially something that you can really intervene and improve people's quality of life. So in that sense, what makes it a real world problem if it's treatable? And I guess the answer here is the key to this is really the sheer size of the problem. So population ageing is a global phenomenon. It's happening all over the place, and millions of people are going to be frail or pre-frail over the next few decades, and over 3 million in Australia alone by 2027. So significant size of the problem. The second aspect that makes it problematic is just how much worse it makes life for older people. So it really increases their risk of things like falls, fractures, disability, hospitalisation, and even early death. And lastly, there's a big awareness gap. So it's really something that as researchers and as society, we're still grappling with and learning about. And this is particularly true in Australia, where there's very little routine screening for frailty, especially in primary care settings. So this is a complex problem, and while I don't pretend to have all the answers to this complexity, I do believe that there are 3 key things we can do as researchers to begin to address this problem. The first is to improve the quality of the evidence base. And by that, I mean really developing robust, strong, reliable research so that we can inform government policy and also clinical practice. The second key to tackling this issue will be to raise awareness about frailty, both in the general public and among health service providers. So the idea that if we can shift hearts and minds, we can also start to shift health outcomes as well. And then lastly, the third thing we can do is begin to work differently across disciplines. So this is a complex problem. It's not going to be solved by us all retreating off to our research silos and working in isolation. So really thinking about how can we bring in new ways of working across disciplines in order to address some of these complex problems. And for us at Torrens, that might mean things like tapping into arts and design or business, hospitality, even artificial intelligence, a whole range of different ways of working that will bring innovative solutions to address the problem. So my research to date has really been an attempt to apply these 3 keys, so improving the evidence base, raising awareness, and working together across disciplines to address the issue of how to identify frailty early within primary care settings. My PhD was awarded through Torrens in February of this year, and it explored the appropriateness of frailty screening in Australian general practice. I've worked as part of an interdisciplinary team together with Torrens University researchers and also with researchers outside the university to complete the first Australian studies that look at different aspects of frailty screening. So we looked at accuracy of frailty screening instruments, attitudes of GPs and practice nurses towards frailty, and also the feasibility of introducing an electronic frailty index into Australian primary care. On a global scale, many of the instruments that we were working with had not been accurately and comprehensively explored. And so this was also a contribution that we made from a research impact perspective. There was also a paper that we developed late last year, and this is with Torrens researchers, Professor Justin Beilby and Dr. Elsa Dent, as well as other researchers. We explored whether screening is ethical, and if so, under what conditions. And that paper's been referenced many times over the last year in The Lancet, which is a leading medical journal, in systematic reviews, but also in a New South Wales policy paper that addresses overdiagnosis among older people. So it's probably one of the things that I'm most proud about, is the direct translation of research into practice. And I've also contributed to a series of frailty awareness videos that are going to be released later in the year. So in summary, I'm hoping that through these approaches and working cross disciplines, we'll be able to tackle this real world problem of frailty head on in a way that will improve outcomes for older people, both now and into the future.
Rachel, thank you. It's such outstanding work, and it's been a pleasure personally to be so heavily involved with it. So well done. That's fantastic. Rachel, I've got a question for you. Clearly, this research has had a positive impact on the quality of people's lives and will do into the future. But you get a sense that this issue hasn't been taken seriously or is only just beginning to. So can you just perhaps tell the audience why it's just beginning to become so important to as we age?
Sure. Thank you, Justin. And it's also, I should say, been a pleasure working with yourself. I think as you'd know, and as we started to explain in the presentation, this is really a new concept for people, this idea that frailty is dynamic and not something that, you know, you just have to accept when you become older. And I think it's taking a while for that idea to sink in, certainly into public awareness, but also with health service providers. So it's really an example of that age-old problem in research, which is the research into practice gap. So something we need to do something about.
Thanks, Rachel. I'm really interested in what you've said there around how just by creating new knowledge, this doesn't automatically lead to a positive impact or benefits that will flow on to the health consumer. So we know that we do need to be working hard around implementation and bringing research into policy and practice contexts. Could you tell us a little bit about how you've been able to do that in your research?
Yes, certainly. So it's early days yet, but Justin and I have been quite heavily involved with the consumer aspect of the research as part of our collaborative CRE. We've contributed to a series of frailty awareness videos that are targeted at both consumers and health service providers that I think have been published on YouTube and should, we hope, have an impact in terms of raising that awareness. And recently myself and Mandy Archibald, who's led the video work, were awarded a grant to have them translated into Mandarin. So we're really hoping this is an international concept, and we're hoping to raise awareness on an international scale too.
Thank you, Rachel. Dr. Rachel Lambach-Scerri. But Rachel, I think you're picking up one of the key themes is the value of teams and working cross-disciplinary as you build a future research program. Thank you very much for us hearing about your research on frailty.
Thank you.
What a great presentation from Dr. Rachel Lambach-Scerri.
Very much so.
Who's up next, Justin? Can you tell us?
The next is we have Professor Craig McLachlan. He's had a long research career with expertise in public health, pharmacology, physiology and translational medicine with a focus on cardiovascular health and technology. He has an absolute passion, which we all love and admire, to improve and understand the burden of chronic conditions. Professor McLachlan has recently been coordinating a research study in Nepal outlining the link between salt and high blood pressure in the context of the socio-cultural and other factors. A fascinating piece of work. Let's hear from Craig now.
Thank you. Let's talk about salt, Nepalese pink rock salt, possibly in your kitchen. If you do have it, it's mined from the Himalayas and it's exotic salt. Here's some salt from my pantry, good Aussie salt, about 10 years old, about 80% full. And, you know, it shows that I haven't used it that much. So I'm not a big salt eater. So is that good or bad from a health perspective? Let's indirectly think about this from a country that loves salt, Nepal. For the budding chefs and nutrition gurus out there, in Torrens land. Let's see how Nepal uses salt. Well, it's afternoon time. So you might like a salty sweet tea, or you might have a sweet tooth. So you might like a salty sour lolly. And then it might be high noon tea. So you like a salty dessert. And then it's mama and auntie in the kitchen with a big pot adding liberal amounts of salt. So you can say that I have a salty tooth. So is this a problem? Well, it's a little bit complicated. Before the last century, in the last century, it was known as the goiter belt. They had goiters because they didn't have a lot of iodized salt. So the NGOs came in and promoted it, and they got rid of it, they eradicated it. But the problem is we still have too much salt. So what is the problem with too much salt? The answer is hypertension, the silent killer, because you do not know unless you have a serious problem. What do these serious problems look like? You have stroke, heart disease, renal disease, and potentially even dementia. But Craig, how do you know it really affects their bodies, you might be asking? Well, we recently measured 24-hour urine sodium excretion in 451 individuals in Nepal and found it was very high. And when we calculated indirectly just how much salt they were taking in, it's double the upper limit of the WHO recommendations. What about auntie and mama who's doing the cooking? Do they feel like they're adding too much salt? No, 55% reported they consumed just the right amount. But when we measured it, 98% were wrong. So while Nepal has tackled, infectious disease, maternal complications and death, we know that salt is just too much. So now in the adult community, we see a burden of chronic disease, such as cardiovascular disease, going up. But Craig, wait, you may be asking, if they're taking a lot of salt for all this time, haven't they developed some genetics to cope with this? Or are they high up in the Himalayas and they've had some adjustment? Well, we can answer that also because we use the May month data that we collect every May with the Nepal Development Society and the International Society of Hypertension. In 2019, we had 70,000 people in the population that we screened for blood pressure and found the prevalence was 24%. So 1 in 4 are roughly hypertensive and only 50% know that they are. Already we know that the Nepal government understands the problem of too much salt, but are focused on industry alignment only. So if there's a can, they put a label on it, or they might ask them to reduce the salt. But that doesn't stop mama and auntie adding liberal amounts of salt to the cooking. So what is the solution? Well, Torrens sees the value in health volunteers, which are part of the health system of Nepal. So we want to go out and deliver an education about salt to the community level with health female volunteers. But you may say, Craig, don't the health volunteers only do maternal health? No, because we've actually retrained them for the first time to tackle chronic disease. And we know in an Coben study, which we published in Lancet Global Health, that we can reduce systolic blood pressure by adding a lifestyle intervention. So at Torrens, with education, design, and the health verticals, we'll focus on delivering a new, unique design message embedded in a health message to household communities, actioned by health volunteers. That too much salt leads to hypertension or makes your hypertension worse. At Torrens, we're working hard to package the health volunteer solution into a scalable product for other lower middle income countries. So to conclude, if you want to affect health of a population, you have to think on a bigger scale. And as we always say with Torrens, we start with people and end with people. The starting point with the Nepal Project and myself, our vertical academics in design, health and education, our long-term collaborators, our PhD students, Gumal and Anita, and the ending with the people is the Nepal community, such that we have a family empowered in the household with knowledge to prevent chronic disease. And what we want to hear at cooking time, someone says, "Oh no, mama, that's too much salt." Or better still, "Oh mama and auntie, who are the boss, says, 'No dear, too much salt, that will give you high blood pressure.'" Thank you.
Welcome, Craig from Sydney, and thank you very much for a really outstanding presentation. You really are, the title is The Research That Matters, and what the work you're doing in Nepal is really very much about making a difference. Craig, you've talked about the influence of salt. Just talk about things a bit more basic, the mortality rate for chronic illness in Nepal. What are the numbers? And if you change the culture around salt, what sort of difference would you make to people's lives in a mortality sense, in a numbers sense?
Well, if you think about diabetes and you think about high blood pressure and other things that are going up at an exponential rate, then that's going to affect both diabetes, hypertension, heart failure, heart attacks. So you think around 25% to 30 to 40% of the population ending up with chronic disease. And they've done very well to reduce maternal deaths and infectious diseases as well. So I think this simple intervention about modifiable risk factors and giving the onus back at the community to look after their preventable health will save the health system a lot of money in the future.
Yeah, that's really, really relevant. And as someone who has a pretty salty tooth myself, I find this research really, really interesting. So you spoke a lot about the role of women in helping solve this problem in Nepal. And I guess we know that Nepal historically has been a patriarchal society where women have been more subordinate to men. So could you tell us a little bit about why working with women specifically around this problem of salt is going to make the positive impact that you desire?
Yeah, I think because they have a good rapport and they build up that rapport because if I go back a little bit before I answer that, the maternal health workers have been trained to reduce mortality. So they've worked a lot with females in the household and they have that rapport so they can go back and they're trusted in the community and can give that educational package, if you like, and influence how health outcomes will be. And I also think it's not only women that have been downplayed. I was speaking to a photographer the other day and he's up in the highlands in Nepal, some of the women have 4 or 5 husbands and they send them all out to work. So they're not all sort of under the thumb, if you know what I mean.
Thank you so much, Craig. I mean, I'm always go women, but definitely you tell us how we need to work together to solve these kinds of really complex problems. So thank you so much. That was Professor Craig McLachlan, who joined us live from Sydney. And that's actually the last presentation in the theme Building Health Solutions. And now we're going to move on to our next theme, which is security and sustainability. So the theme of security and sustainability, we have 2 of our very finest researchers who are working in this space to develop secure and sustainable practices through their research. And their focus is on global problems and the research that they do will have ethical, social and environmental impacts into the future to hopefully safeguard the world that we all share together. So who's first up?
Thanks, Louise. First up is real pleasure is Dr. Sarah Baker from the Media Design School. Her research interests includes design and social inequality, especially in relation to user experience, ethics and critical design. She'll outline the role of designers and user-centred design for building sustainability and social equality. I'm really looking forward to Sarah and would like to now introduce her to give us the information underlying her research.
Thanks for the introduction, Justin. My research focuses on user experience design and design futures, particularly in relation to sustainability and social inequality. So I believe that design is essential for creating change. And by design, I mean not just trying to make things look appealing or functional, but an approach to problem solving that tries to find meaningful solutions. So design approaches can be used to create things as diverse as chairs, to artificial intelligence, to political systems. And they provide a critical framework for learning through doing, and one that's about embracing failure. And for me, design is really powerful because it's not just about theory, it's about action too. So if we really truly want to move towards sustainable and equitable futures, then design is fundamentally important. In fact, I would argue that many of the 17 UN Sustainable Development Goals can only be achieved by utilising design approaches. So for example, a designerly approach to zero hunger might consider how we can connect producers who have surplus amounts of food with people who need it. Design methods and processes are really good at working across disciplines and involving everyone in that process. So in the zero hunger example, designers might work with farmers, they might work with agricultural specialists, supply chain experts, and end users to work towards a solution. So to address some of the other sustainable development goals, designers might work with health practitioners, with experts in Indigenous culture, or with those at the forefront of business innovation. And at MDS, our emerging areas of expertise are design for health, Indigenous culture and emerging technology, and the future of the creative industries. My own research falls within that last theme and speaks to the UN Sustainable Development Goal of gender equality. Design and creative technology still has a way to go in terms of gender. And I hope this example isn't too shocking, but when Siri was first launched onto the market, if you told her she was a slut, she would reply with, "I'd blush if I could." This is obviously pretty appalling in terms of modelling attitudes and behaviour towards women. Because of widespread critique, Siri doesn't respond like that anymore, but it's a really good example of the ways that gender issues are involved in design and technology. It's not just an isolated incident, and for gender diverse and for trans people, the gender bias of design is even more apparent. I don't think that design and technology reproduces inequality because designers are sexist, or that all corporations want to discriminate. I think it's partly a product of a lack of diversity among design and tech teams, and hopefully that's something that Torrens and MDS can change. But also for me, and this is the focus of my research, design and creative tech inadvertently reproduces gender inequality because design methods and processes have specific histories within Western patriarchal societies. So, for example, design thinking often uses user personas which generalise behaviour, and in doing so they reproduce assumptions about gender. So my work is focused on developing more inclusive design methods. So I use gender and queer theory with design research to propose new tools, and I'm currently starting to test some of these tools with designers and communities. I'm planning for the research to come together in a book, the Design Agenda Toolkit, and I'm really confident about the positive social impact that design can make, and hopefully the book will make a useful contribution. And before I go, I thought I'd leave you with a thought about design in the future. As many of us sit watching this in our home offices, some more makeshift than others, the way we use our homes is really changing. But visions of future homes have changed little since the 1950s, and they have frequently ignored the needs of anyone other than the straight white man. What if smart homes, for instance, address the needs of women, the gender diverse, the differently abled, children, and the non-humans that live in our homes? For me, that's the radical potential of design, and I hope you feel inspired to become involved in co-designing this alternative future with me.
Hi, Sarah. We've got Dr. Sarah Baker joining us now from New Zealand. How are you, Sarah?
Good, thank you.
Oh, that's wonderful. I really enjoyed your presentation. It really reminded me how design has the power to facilitate transformative processes. And it reminded me also the way that the research that we do goes towards building a preferred future. So my question for you this afternoon is around working with diverse stakeholders, because clearly in design you're not working alone, you're working with many, many others, and in many cases it's very much a matter of persuasion. You're trying to bring people along, with you as you work towards a preferred future. So can you tell us how you've been working with your stakeholders who might have very different goals sometimes?
Yeah, thank you. Thanks, Louise and Justin. That's a really great question. And I think historically designers have always worked with a number of stakeholders, usually a client and their users. But increasingly the number of stakeholders that designers are working with is growing, and that's partly because problems are becoming more complex, or we're seeing them in more complex ways. And there are some really great methods from design, so co-design and participatory methods that I use when working with a number of stakeholders. And I think the first thing in those first project meetings, they're really important, is to think about or address some of the assumptions that people make about the project, and to then set some common goals and think about common values. Because then along the way in the project, if you go kind of off course, which happens often, you can come back to those shared visions and kind of come back together as a team again. So in terms of gender, quite often the people who are really focused on fixing urgent problems, they might have a quite different kind of perspective from someone who's a bit more futures focused, so maybe someone like me. But actually, usually in those first meetings, what you find is there's a lot of common ground.
Sarah, I've got another question that builds off the vision of your toolkit. I have no doubt you'll be successful. And one of the things that I enjoy about the partnership across Australia and New Zealand is the cross-fertilisation with research. So when your toolkit's published in 5 years and you're famous and you think you go back into the past, how will it influence how a home would be designed in the future? If I'm designing a home in 8 years' time, just give me a little practical example of how it really, the research you're doing will make a difference to people's lives.
Well, yeah, it's quite a hard one because the work hasn't been done yet, but I think some initial ideas might be thinking about novel approaches to cooperative housing that allow for things like the sharing of caring responsibilities, or communal access to industrial equipment, for example. I think those kind of, I guess, reframing the problem or rethinking ideas of home might help in terms of gender. Also, it might include some things like thinking about domestic technologies differently. So at the moment we focus, or they are focused mostly on individual efficiency. But what about if we change that to think about the redistribution of labour? So, for example, one of the postgrad students at MDS designed a smart notice board and an app that gamified cleaning for everyone who lived in a home. And so it had very real rewards tailored to the individual if they completed those tasks. So there are just some kind of ways of reframing the problems when we think about homes. And I hope that in the future some of those solutions can be realised, and it will make our lives more enjoyable.
Thank you, Sarah. Good luck. You don't need any luck. I have no doubt you'll be successful. I look forward with great pleasure to see your research evolve over the next 5 years. It was lovely to hear from Dr. Sarah Baker from the Media Design School from across the I was going to say the ditch, but across the land between Australia and New Zealand.
That was awesome,
Fantastic.
Justin.
Wasn't it brilliant?
Yes, I have a lot of time for designers at Torrens. Always feel inspired after hearing from them. And I am going to introduce our next presenter, and that is Dr. Hayden McDonald. Hayden is an accounting guru, an educator and a researcher, and he's passionate about social justice issues and how these can be used to influence business practices. So Hayden is a fairly new researcher at Torrens, so really, really excited to hear some of his research findings around how he's been engaging with key stakeholders recently.
Thanks for the introduction. Right now, indiscriminate business practices are disenfranchising Aboriginal and Torres Strait Islanders and in ways that affect their identity and psychology. In preventing Indigenous voices from being heard, valuable insights on protecting and preserving both people and country have been suppressed. But imagine a business world where social and environmental values are harmoniously accounted for. To move to this world of heightened awareness and consciousness, businesses must develop transparent ways of accounting for these cultural values. To get us there, we need new ways of consulting with Indigenous communities. I'm working on a project with CPA Australia and Griffith University to develop managerial tools that inform or that address indiscriminate business practices. Specifically, we're developing a management framework that will inform policymakers and business leaders about how to include Indigenous perspectives when managing culturally significant assets in business operations. So let's consider the problem here. A significant need exists for more research that joins business pursuits with the values of those whose voices have been disenfranchised. We address a specific area where confusion exists about appropriate frameworks required to recognise and report on fundamental Indigenous values. Many Australian organisations are now implementing a reconciliation action plan to incorporate Indigenous cultural values within their existing business practices. However, this approach to reconciliation risks becoming more like a box-ticking exercise. What is really needed is an ongoing consultation process that serves the purpose of constructive dialogue as opposed to bureaucracy. Now to our methodology, which includes a comparative study of an Indigenous and non-Indigenous organisation. We examine how people such as Indigenous elders and managerial employees, along with technologies such as artwork and key performance indicators, collectively define and mobilise Indigenous cultural values. We've now analysed several business documents and spoken with managerial employees. We plan to meet with Indigenous elders, land council members, and additional employees. This research will help us understand where Indigenous cultural values actually sit within businesses and how these values ultimately influence broader business objectives. Findings from our extensive data analysis highlight both similarities and differences in the way that Indigenous and non-Indigenous organisations implement reconciliation action plans. Both organisations placed great importance on cultural initiatives such as artwork, ceremonies, and rituals. However, the nature of their approach to culture was very different, potentially landing the non-Indigenous organisation further away from reconciliation outcomes than intended. This point was evident when analysing semantic differences between data collected on each organisation. The Indigenous organisation used phrases such as collect information, investigate opportunities, and inform future initiatives. Conversely, the non-Indigenous organisation used phrases such as build an understanding, develop a business case, and research best practice. So while culture was important to both organisations, different approaches to consultation indicated that each organisation would land on different reconciliation outcomes. The semantic differences observed in our study could signal an opportunity for synergies between Indigenous communities, researchers, and organisations implementing reconciliation action plans. Because we know where the work needs to be done. So these synergies are critical. Transparency is lost without ongoing and respectful dialogue and engagement. While non-Indigenous organisations might think they are being transparent by implementing reconciliation action plans, in reality, these organisations risk speaking different languages if ongoing consultation with Indigenous communities is not maintained. Our framework will assist Australian organisations to implement reconciliation action plans using managerial tools that reconcile Indigenous perspectives with broader business objectives. An Indigenous CEO that we interviewed stated that he just wants to be taken seriously. His remark was made despite leading a very large Australian organisation with plans to be the first Indigenous organisation that's publicly traded. That no Indigenous organisation is currently publicly traded on the Australian Securities Exchange highlights the need for further research to emancipate businesses from indiscriminate practices. We have a unique opportunity as employees and researchers at Torrens University. We are empowered to be here for good. So in closing, imagine a world where businesses have a heightened awareness and consciousness of their responsibility to both people and country. Now, what are you doing to ensure that disenfranchised voices are heard and ultimately valued? Thank you.
Thank you, Hayden, and coming from live from Queensland. And thank you for your sharing your research, which is both has a beautiful here for good and that issue around innovation, which is a absolute pleasure to see and to watch. We're delighted to be able to help you build your research career at Torrens, Hayden. Louise, what did you pick out from the research he described?
Yeah, hi Hayden, welcome to Research That Matters.
Hey guys.
There was something you said that really got me, and that was around how our good intentions don't always translate into good outcomes. So sometimes we end up further away from our intended result. I was wondering if you'd be able to share with us a little bit about how you think we can ensure that our research does have a positive impact.
Thanks, Louise. Yeah, I think our research culture is key to producing research that that has positive impacts. Producing research that matters, as Justin has mentioned in the past, is about creating benefits for people, societies and communities. And I see this as a call to prioritise collective objectives over individual pursuits. Basically, we've got to work together. And I mentioned in my presentation that non-Indigenous organisations will end up with unsatisfactory reconciliation outcomes if ongoing dialogue with Indigenous communities is not maintained. And the statement is seemingly obvious. If you don't communicate, you don't succeed. But when you look at the problem a little more closely, you realise that that embedding transparent and inclusive processes within organisations is a complex undertaking. How do we control? How do we win? How do we divide up resources and rewards and so forth? And so similar problems exist when contemplating our research culture. A great deal of trust and humility is needed to prioritise collective objectives. But I believe by sharing our knowledge and partnering with other researchers, industry and community members, then we will produce research that has positive and intentional impacts.
Hayden, as someone who's been in Indigenous research for many, many years, change is very slow and difficult. If the research, I have no doubt, will be successful and arrive at some outstanding conclusions, how will you influence policies and policy makers to produce change that will be respected and trusted by the Indigenous communities, Hayden? How do you think you'll move forward with the research?
Thanks, Justin. Yeah, I think it's very important, to reflect on past wrongs with transparency and honesty. And sadly, past research practices have also excluded Indigenous voices from being heard and valued. And this really motivated us to select a methodology that ensured that our research serves Indigenous communities. So, for example, culturally appropriate data collection and analysis tools. We use these tools such as yarning circles and interpretation workshops, and this is done so that Indigenous voices are privileged throughout our entire research process. Another research member of the project is Dr. Kerry Bodle from Griffith University, who identifies as Aboriginal Australian, and this is also really important. Kerry has extensive experience in following cultural protocols and respectful communication and research, and she's also strongly connected to influential Indigenous organisations and agencies, which is important also from a policy perspective. And a policy priority for the Australian government is to promote reconciliation amongst all Australians. And so reconciliation action plans are now encouraged throughout Australian organisations and agencies so that actions are taken to promote and improve reconciliation outcomes. So the framework that we're developing is really beneficial at both a business and a national level, but it's not enough just to have this significant need that we're addressing. Ultimately, we're going to produce high quality research, and we're going to communicate that through a number of mediums, including influential Indigenous organisations and agencies. We've got plans to publish our research in CPA Australia's Global Industry magazine and also in academic journals. And so this is really about progressing policy agenda. And so for me, it's been an absolute privilege and honour to learn from and engage with Indigenous communities. And I certainly hope that more stories like this one are communicated throughout business and political arenas, so that the richness and diversity of this wonderful culture is shared and can value all people.
Thank you so much, Dr. Hayden McDonald, who was calling in from Queensland.
I'm Justin Beilby, and this is Louise Townsin, and we're here at the Research That Matters. We're now going to we're having a spotlight on our researchers from across Australia and New Zealand. We're now moving to our third theme, which is people and industry for impact. We are now very much part of global innovation and how work-ready programs are being delivered and how students are preparing for future employment opportunities. Rapid technological change is disrupting businesses across all industries, and some of our researchers who are going to present now are doing really clever, thoughtful work in identifying new skills and capabilities required for all of us, our students, and as we go into the future. Louise.
I am really, really happy to be able to introduce the next presenter in this new theme, People and Industry for Impact. I would like to introduce Dr. Mandy Baker. She's a research fellow located in the Blue Mountains. She does a really interesting work around personal people skills that are required, or soft skills that are required for work now and also into the future. And she works across a range of different contexts, including youth development, community development, recreation, tourism, etc. So really happy to hear from Mandy now.
There's nothing more powerful than COVID restrictions to make us acutely aware of our need for human connection. We crave nurturing, meaningful, and positive connections with others, and not just in our inner circles, but in all of our interactions, ranging from everyday moments with our local barista to the life-changing ones like traveling abroad. Yet the lack of training that frontline employees get in people skills and the decisions organizations make about supporting the emotional demands of service delivery are presenting many problems. In fact, situations like this pandemic or the widespread response to George Floyd's death remind us that we need to rethink how we value and prioritize meaningful and respectful human connections as individuals, in the workplace, and in our system of governance. Hi, I'm Mandy Baker. I'm a passionate researcher in the Center for Organizational Change and Agility. My mission is to contribute to a socially just world by equipping youth and young adults with the people skills for meaningful service work and their employers with the knowledge to make employment ethical and sustainable. I've been pursuing this mission by using a range of theories from post-structuralism, adventure education, and leisure management, as well as qualitative methodologies like thematic, reflexive, and discourse analysis. My research responds to our need for meaningful human connections in the following three ways. First, strengthening the affective abilities of future leaders. Deloitte's report points out the cost of recruiting and training staff with adequate people skills in Australia is $7 billion a year, with demand for soft skills wildly outstripping supply by 45%. McCrindle's report tells us that parents and teachers want to future-proof students by developing stronger people and leadership skills. We need to prepare the next generation for a future where technology and automation make the majority of their work reliant on interactions and connections with others. These personal and interpersonal skills are called affective abilities. And what I've learned over the last 6 years of research on this is affective abilities can and should be developed ongoingly. Higher education and employers have a significant role to play in developing affective abilities of new professionals, and well-developed affective abilities can buffer the demand of service jobs, making workforces stronger and service delivery employment more sustainable. By strengthening affective abilities, leaders, organizations, and countries benefit not only economically through human capital, but societally through human development. My second area of research addresses how to support the emotion work of service providers. Emotion work is when we are paid to manage our feelings and values in order to deliver a promised emotional experience to a client or participant. A good example is when an airline host puts on a smile whilst they're delivering a bag of pretzels to make a passenger feel comfortable. Emotion work is particularly demanding for frontline service providers like nurses, teachers, and hospitality employees, and not surprisingly, extended or intense emotional demand on employees leads to burnout with costly impacts to organizations and individuals. However, scheduling, remuneration, recruitment, training, and performance reviews rarely account for or support emotion work due to the perception that it's just too hard to measure. My research explores the unique nature of emotion work, particularly in youth employment. My recent book deals with how this is impacted by imbalanced relations of power with employers and participants. And through my research, I've been able to educate leaders, professional associations, and government to ethically and sustainably manage the emotion work in the Australian outdoor sector. My third area of research is enhancing well-being through inclusive recreation. Recreation in our lives is often undervalued. In fact, the pandemic has seen recreation deemed non-essential, yet we're feeling the effects of its absence in our lives. Recreation at its root is recreation. It signifies a time, place, or community where we recreate, we reconnect, and we redefine what's important in our lives. It only takes a quick scroll through social media to recognize that there are many systems that oppress, silence, and fail certain people and privilege others. Recreation is no different. Travel, sport, eating out with friends, walking in the woods, attending concerts are largely for those who are privileged, those who can afford the clothes or equipment, those who have the means to access it, and those who feel welcome to participate in it. Unfortunately, many people are excluded. I want to change this, and not just in the messaging and the practices, but also in the way that recreation and leisure providers think about inclusion in recreation. I'm pursuing this through research such as women's only refugee youth hiking across Australia with the First Hike Project. I'm co-editing an interdisciplinary special issue and book that debunk the myths about who's welcome in the outdoors. And I'm looking for ways to transform cultural appropriation to cultural appreciation of Native traditions within North American summer camps. This will allow people and populations that have traditionally been excluded to reap the social, psychological, and health benefits that being outdoors affords. COVID-19 has made it clear that we need meaningful and respectful connections. This can and should happen in our everyday encounters in work and at play. There's much we can do to bolster affective abilities, make workplaces supportive of emotion work, and make recreation truly inclusive.
Mandy, welcome, and thank you from Sydney. Thank you very much for your, what was really a beautifully timed presentation for what we're trying to do at Torrens Think in the Media Design School. One of the things I just want to push you a little bit and get you to think through with us is how, as Alwyn said, how we bring research into curriculum changes and how you bring it to your teaching so that that very difficult concept you've described in measurement, and I do admire the work you're doing in trying to understand it, can be drawn into our teaching for our students to allow them to gain the value of your research as you go forward, Mandy.
Sure. Well, I learned how to teach in an unusual space. I started teaching in recreation and outdoor education. And the kind of pedagogies you learn when you're having experiential, like real live experiences, can be quite different than what is employed in universities. And what I also learned in those spaces is that they're very community-based. They're focused around students, participants, clients, whatever you want to call them, but they learn through their connections with people, and they learn through their connections with each other as much as with the leader or the coach or the teacher. And I realized those connections, that community-based learning was super important, but that we really needed the people skills to do it well. And that isn't always apparent. Higher education has been very focused on graduate outcomes and employability, has been very focused on social and emotional intelligence for a period of time. But my research, more recent project came back and said, universities, higher education are trying, but they're doing it often explicitly. And some of the theory I use says if someone doesn't have a discourse or a set of language or a way of thinking available to them, there's no way that they can engage, use it, or retain it. So that implicit kind of teaching of soft skills isn't effective enough, and that we need to make a shift to making it explicit. Yet the challenge, of course, is always, how do I make this thing about teamwork or emotional intelligence a part of my course when I have a curriculum to deliver? So some of the things that I've started doing creatively in my own teaching to try to bring that content in, knowing that it's important that it's there in a sort of consistent, explicit manner. A good example is the undergraduate research course that I used to teach in, that the first thing I would get them to do is be assessed on their knowledge of journal articles, probably pretty traditional, and I gave them a qualitative, a quantitative, and a mixed method. Now, the mixed method was specifically about the teamwork skills and abilities that university students need to be successful in university courses. So they were learning the content and I was testing them on it. Then the course sort of closed out with a research proposal, which was pretty, again, traditional for that kind of course. But it was a proposal in a poster format in which their peers evaluated them, and that I made that evaluation substantial enough that each peer that evaluates, and they were allocated two, could give them up to another 5% in the overall course. And that they could lose 5% by not completing, it's not just not completing an evaluation of someone else, but a respectful, constructive evaluation of someone else. And then we rounded out the course with a peer evaluation that was based on the results of that mixed method article that I had them read. So there are ways, even when our focus in curriculum is on something else or on different content, there are ways of cleverly yet explicitly drawing skills around people and connection and community into that course and into that conversation. So there's a lot of space for creativity there.
Thank you so much, Mandy. I can totally see why we're friends. We'd like to talk about curriculum and pedagogy, but it's just so motivating to hear your ideas and how you've brought your research into the classroom to really develop meaningful connections among peers and between teachers and learners. So I have a question, because you know I'm a huge supporter of your research, and especially when you talk about emotion work and how this can be quite burdensome for us when we are engaged in emotion work and our job requires emotional investment. So could you tell us a little bit about what your research has found, how employees can be supported, to be able to cope with ongoing emotion work?
Yeah, my response is, again, fairly similar to the last. It's the solutions are often in the small everyday gestures or the small everyday sort of steps that we take. They're creative, yet those small things really count. So to be really honest, the work of emotion work, or the emotional demand and what wears people down and makes them tired, that's never entirely going to go away. But that there are multiple stakeholders in being able to not just buffer, but support and make viable and sustainable that kind of effort, that kind of giving that often it's the frontline or contact level staff give. And probably worth noting that frontline or contact level staff are often the least experienced and the least supported or the least trained. They're the most distant from where that support can come from. So like I said, there are stakeholders, multiple. The employee has responsibilities for managing their own emotion work, yet I would also argue they're managers and supervisors, but also the leadership of large groups, companies, institutions, and in the artifacts of those institutions. Things like staff manuals and policies can make a big difference to whether or not emotion work is seen, recognized, supported, remunerated, scheduled in such a way that it is, like I said, healthy and sustainable. For the employees, however, I can give a few suggestions. The first thing is develop your soft skills, or in my research is called affective abilities. By developing them and having confidence and competence in these skills, there's a lot more buffer for the really demanding, tricky and critical incidents. And emotion work is both in the everyday small interchanges as well as the critical moments. Some other things are to take care of your physical, mental, and emotional health, and be an advocate for yourself. Assertive, but advocate for your own health. Create healthy boundaries, especially if you have a caring role in your profession. It's important to have those healthy boundaries, and look for and seek out mentorships or supervision or those kinds of relationships with people who are more experienced, potentially more senior, that can give you their tips and tricks of the trade. And then, of course, for employers, it's about being sensible about how you schedule the amount of contact level work and the demand and energy that goes into it, as well as hiring for and including those soft skills that are necessary in the hiring evaluation process.
Thank you so much, Dr. Mandy Baker. You gave us so many tips there. I'm going to have to watch the recording again and take notes.
Yes.
But thank you so much for joining us at Research That Matters. We enjoyed hearing about your research very much. And I think you've got the next presenter for us now, Justin.
I have, and there's no doubt that the Research That Matters is coming forward in all the presentations today, which is just so important as we move forward. We now have one of our PhD students, which is presenting for us. I need to underline the importance of the PhD students as the university builds its future in partnership across Australia and New Zealand. They're so important. They're the backbone of our research culture, and they are really our future, as a number of people presenting today have had PhDs and gone on to become roles such as Louise today and Rachel earlier. Damien Mills, I'd like to introduce in his presentation is how we develop and strengthen entrepreneurial ecosystems by improving the understanding of the very concept of entrepreneur, so relevant to who we are today. Over to Damien. Thank you very much.
Thanks very much. In 2003, the Government of Scotland set up the Intermediate Technology Initiative. Their budget was £450 million. 10 years later, in 2013, they gave up after having spent £231 million and created a sum total of 5 new tech-based startups and earned just £600,000 in licensing revenue. It was a very expensive failure. This is not an uncommon story, as governments around the world have sought to boost and drive entrepreneurship. Also, in 2013, I was asked to review the entrepreneurship curriculum in one of South Australia's business schools. The curriculum that I found was largely a redo of existing business planning curricula. There was no coherent definition of entrepreneurship, nor one describing the entrepreneurial ecosystem or the entrepreneur. My curiosity was piqued. This led me to a research program to address the following questions. What is an entrepreneurial ecosystem? What defines the entrepreneur and entrepreneurship? Where did entrepreneurship come from? How does entrepreneurship work? I discovered quite quickly, though, that there was a high-profile public dialogue that spoke of the entrepreneurial ecosystem, entrepreneurs and entrepreneurship, and success in all of these, but there was almost nothing in that dialogue that deviated from the basic interpretation of business planning or macroeconomic development theory. The entrepreneurial ecosystem was defined as a place where entrepreneurship happened. The entrepreneur was labelled the heffalump in 1971 because entrepreneurs, like the heffalump, are often talked about but never actually seen. Are they imaginary friends like Mr. Snuffleupagus? This issue remains to this day, and the academic discussion, including heffalumps, is still current. Who really is an entrepreneur, and how do we know? My research addresses these issues, but most importantly to me, it addresses the issue of where innovation actually originates, because at the heart of entrepreneurship is an insight that becomes the innovation that the entrepreneur turns into an entrepreneurial success. So my research seeks to organise the idea of the entrepreneurial ecosystem. It organises the many related ideas of what an entrepreneur is. It proposes a system of things that help or hinder the entrepreneur in their quest for success. It proposes a historical narrative for the origin of the entrepreneurial innovator, because 500 years ago, a tiny fraction of the world's population had ever even seen a book, let alone read one. 400 years ago, people devised the idea of an experiment and they discovered air. 300 years ago, all cloth was hand woven. The steam engine had just been invented. 200 years ago, the steam engine had just become useful enough for Stephenson to add a steam engine to a mining railway cart that up until that time had either been pushed by humans or a child or pulled by a horse. Entrepreneurship as we know it, that is, technological innovation leading to new practices and products, simply did not exist 300 years ago. How and why this change occurred is crucial to understanding why it happened, where it did, and when it did, because it only happened in Northwestern Europe. My research focuses on understanding the origins and mechanisms of entrepreneurship. In time, I hope to be able to assist in improving the understanding of entrepreneurship in the community, business and government. Not only did the Scots discover that it takes more than money and goodwill to drive entrepreneurship, they also discovered that they did not know how to turn research into self-sustaining entrepreneurship, regardless of the hundreds of millions of pounds dedicated to that ambition. That problem remains. My research has interacted with academia across education, digital forensics, economics and strategic management, just to name a few, with industry over a decade, or more actually, and with government through my academic stewardship of the creation of the new South Australian Government's entrepreneurship specialty schools. That has been a particularly satisfying project. This research necessarily runs across a diverse set of disciplines: history, economics, psychology, obviously ecosystem theory, both biological and economic, but also philosophy, art, which I really enjoyed, politics, theology, and most amazing of all, hypnotism. Hypnotism seems an odd aspect, but in the 1870s, it revealed the idea that we can change who we are and change our fate. That this is so surprised and fascinated me, because entrepreneurship at its very core is based on the belief that we can change not only our fate, but our futures. And it was an entrepreneurial aspect around hypnotism that brought that to the fore. Thank you very much.
Thank you, Damien, and welcome based in Adelaide. Thank you very much for your very thought-provoking presentation. I look forward to see how your PhD evolves, particularly when you start with the word heffalump underlying some of the words you're talking about, the large, mysterious creature. You've talked about the ecosystem and you've talked about your experience from a historical and a personal perspective. Just dream about 2 or 3 years down the track. What are the elements you think you might find that are influencing the ecosystem in a positive sense? What are some of the things that might be areas you might end up in?
I'm seeing that as the question is where to from here. I think the first big challenge is to try and put together a coherent volume. Now, whether that's done through digital or just writing a book, I'm not yet sure. But to put out into the wider world the structures and organisational tools that I've created to this point, which allow us to break the discussion up into pieces that can be managed in relation to all the other pieces. I'm hoping that we can improve our public policy around the resources that we put into entrepreneurship. to make them more effective. In some ways, we continue to do the same things, and I hope that somehow we will get a better outcome, and that's not happening because we look to Silicon Valley for a model, and like many things, what we see of Silicon Valley is effectively public relations, let's call it that, from Silicon Valley that gives us an impression rather than actually where it came from and how it came to be. And I also hope to have furthered my endeavour with getting our education, our school education system, to better understand that entrepreneurship is fundamentally about people's needs and how they relate, and that entrepreneurship as an economic activity is about meeting those needs. And so it's a big hill, but I think we'll get some way up it.
Thanks so much, Damien. I really have been engaged in your doctoral study for a little bit and have seen you present to the Adelaide community here around your ideas around entrepreneurship. So very, very interesting, your perspectives that you're bringing and sharing. My question is around your perspectives around history, and you've said you've brought in lots of different ideas and concepts and working from social science. I just wanted to know, we've heard from previous presenters today who've been talking about the value of bringing in diverse perspectives and different cultures. Could you tell us a little bit about how the field of entrepreneurship can be sensitive to multicultural perspectives? And by that I mean beyond the sort of Western definition of entrepreneurship.
Oh, that's a very interesting question. It's a very interesting question. And it could be, how do I address this? Effectively, entrepreneurship as we understand it, particularly out of Silicon Valley, is a product of a particular cultural and religious and historical pathway. Entrepreneurship and innovation and things have existed in other places, but sometimes, well, almost universally actually over a deep historical look, that entrepreneurship involves change, and change is often opposed. And so across cultures, when people are looking at entrepreneurship as it's presented today, it becomes a cultural, shall we say, mixing, a melting pot. And to a large extent, the process of innovation requires different perspectives. You need to see the future in a different way. And so we get this process where cultural mingling, and that's across not only just across, say, nations, but also diversity. People have different views of how the world is. Their future views allow us, so I was listening to the lady talking about designing physical structures and including diversity in those things. So we say Siri allows us to talk to our computers now. So for people who have a disability to be able to actually type, it is now possible for them to interact with the world in a way that they never could even 15 years ago. And so entrepreneurship looks to solve problems, and problems are often found where monocultural views fail to find solutions outside of that view.
Thank you, Damien. There was Damien Mills, one of our very talented PhD students based in Adelaide. And thank you very much again.
You're welcome.
Thanks, Damien. We have our last presenter in this theme. The theme, I'll remind you, is People and Industry for Impact. And I have great pleasure to introduce our next speaker, Dr. Denise D'Souza. Denise works in Melbourne. She's a part of the Centre for Research in Education. She's specifically working on the Impact 21 program, which I know lots of people know a little bit about already. This is a program that is working with a small cohort of individuals with Down syndrome and helping to support them into meaningful work and employment. So I'm really looking forward to hearing Denise's presentation now.
In 2017, an OECD report confirmed what we all know, that people living with an intellectual disability are hugely underrepresented in Australia's workplaces because of low expectations about this group's ability to work and insufficient support to help them transition from the educational institution to the workplace. My research aims to address this problem. Impact 21 is an education to work program for young adults with Down syndrome. The program has been designed by Motion 21, who is collaborating with Torrens University and 5 national corporations to provide both educational training and employment experiences to the students enrolled in the program. The question arising in relation to the theme of people in industry for impact is, how should we approach this problem to draw most out of our combined knowledge and experiences? In this instance, I drew on the notion of comprehensive reflective practice, which looks at problems through 4 different lenses: the lenses of your colleagues, the lenses of your students, your own personal lenses, and the lenses of the research literature. I'll try to give an example of how I engaged in this while working on the Impact 21 project. Now, research has shown more positive employment outcomes for individuals with intellectual and developmental disabilities attending training programs than their peers who did not. Research is also available on possible instructional strategies to use for them in the secondary school setting, as well as possible on-the-job training strategies. However, there seems to be a gap in research on programs that try to train and support young adults with intellectual disabilities in the transition phase from education to the workplace. So we try to understand what this transition might look like at the level of a post-secondary education program. We wanted to know, firstly, whether it made sense to focus on the education to workplace transition phase, or whether it would be more cost efficient to just delve into on-the-job training. Secondly, whether the students themselves found the transition phase a valuable investment of their time. And thirdly, if the first 2 questions produce positive responses, then what kind of tutorial room and workplace instructional strategies might be appropriate to adopt? To get answers, I conducted discussions with the Impact 21 program director, held face-to-face and focus group interviews with the Impact 21 teachers and students, did some tutorial room observations, and accompanied the students in their job taster experiences. The insights gained from viewing the problem through these multiple lenses became valuable content for reflection. From the lenses of my Impact 21 colleagues, a transition phase is beneficial because the tutorial room environment provides students with a safe space to learn. In this space, they can feel overwhelmed about having to learn new skills, about job expectations, they can get worked up, and they can make mistakes without being judged. This safe space will enable discussions on what students can do to manage their emotions and their learning and how to improve on them. From the lenses of the Impact 21 students, we've learned that the educational training component of the program is important for them because it helps to develop their confidence about their employability. It gives them time to improve on their work communication and to build a social support network. From my personal lens, an important question to ask is what kind of instructional and assessment practices are appropriate? We have to keep in mind that any assessment we design or select must meet the standards of the Australian qualifications framework, and that the instructional practices we use must accommodate the learning challenges that our students have, as well as prepare them to be work ready. From the lenses of the academic literature, we know that individuals with special needs tend to have difficulty transferring the skills and knowledge they acquire from the learning context to a new setting. This suggests that they need to be given multiple opportunities to respond to instructions and to practice skills. My reflection from all these sources has identified possible instructional strategies for the tutorial room and workplace. In the tutorial room, these might include providing them with opportunities to practice tasks in a variety of settings, using simulations and recordings of tasks carried out in the work setting, and teaching students to use self-talk or self-instruction to complete tasks where appropriate. In the workplace, these strategies might be demonstrating the required skill with or without verbal explanation, decomposing a task into smaller steps and using pictures or storyboards to show the correct sequence for performing a task, and fading out these thoughts and prompts when the employee can do the task fairly independently. Now, how does this affect the public? At the moment, we are still in the planning stages of the Impact 21 curriculum. Once the program is running again, more fine-grained research can be done to find out if certain instructional strategies are more effective to use with certain types of learning tasks, and whether students with different learning and retention challenges respond better to specific instructional strategies. Thank you.
Denise, welcome from Melbourne. Before I ask you a couple of questions about Impact 21, I'm just going to break the script, which they're not happy with me here, but we'll deal with that later. We've got over 250 people listening today, and I'm starting to read some of the comments, and people are being offered jobs on employability committees, new curriculum developments, partnerships across the university. This is what we're on. This is why we're here. The research that we're creating and developing does matter, and it does feed into curriculum and does feed into our future right across the university. So thank you all for listening today. Denise, Torrens is incredibly proud of what we've done with Impact 21, and we're very privileged, I believe, to be really building a disruptive model of looking at disability from an employment lens and from an opportunity lens. I feel very strongly, as I know you do, that disability could be one of the areas of Torrens that will grow in significance over the next couple of years. Can you tell us how this research has actually impacted yourself, but more importantly, the Flinders Street campus? Because I've heard stories about the importance of this research right across the campus, Denise.
Right, okay. To the first question, how has it impacted on me? I think the most striking thing for me has been knowing that we all share one world, but the experiences that we have within the world is really quite different based on our culture, our context, on who we are and on how we are. I remember during this project, I took a 2-hour train journey, or 2 or 3 2-hour train journey to interview the parents of the students or our Impact 21 job seekers. Now, this 2-hour train journey is a journey that the students or job seekers actually take 3 times a week to get to university, and it's probably the commute that they will make when they go back, when they get into their work. Now, while it speaks volumes about the Impact 21's job seekers' willingness to overcome a lot of inconveniences and challenges just to get into paid employment, sometimes I wonder whether, as a society, we are doing enough to give these deserving individuals the same kind of opportunities, job options, and freedom of choice that we all tend to take for granted as a basic right. So of all the experiences that I've had throughout this project, this point is the one that has impacted and stuck with me the most. Now, how has Impact 21 influenced or affected Torrens University at the Flinders Street campus? I think one of the most rewarding things that I've heard is that the students kind of bring people together. For example, I know that the service group, those who deal with hospitality, for example, they've included the students to within some of the work that they've done, and the students who are taking the higher degree, the master's degree, have been part and parcel of helping the Impact 21 students who did a service option at one of the functions, who worked at the functions. So some of the Impact 21 students have been supervised and mentored by the hospitality students during a function organized by Emotion 21. And I think that function brought about a lot of rave reviews, and many people were very appreciative of the inclusion that took place at that point in time.
Thank you, Denise. I always love hearing about Impact 21 and especially the experiences of the students and everyone on campus at Flinders Street. So thank you for that. My question is around the research topic of disability and employability. It's obviously not just something that's important in Australia, it's something that has global significance. And I believe you've been able to make some strong international connections as your research has progressed. So for example, I've heard that you work with some researchers in Chile, and you've also been in contact with researchers in Ireland, for example, who are very interested in this particular pilot. So could you tell us a little bit about those connections that you've been able to make?
Thanks for that question, Louise. Through the Inter-Institutional Research Grant by Laureate University, what we've established is a collaborative relationship with Andrés Bello National University in Chile, in Santiago, Chile. Now, they've been running a diploma program for individuals with intellectual disabilities since 2006. We're collaborating with them because we are interested in the curriculum design that they have, and they in turn are interested in the implementation of the customized employment component within the Impact 21 program. So we're collaborating on that with the university in Chile. More recently, the Center for Research in Education has been holding discussions with the director of the Trinity Center of People with Intellectual Disabilities. This center is located with the School of Education of Trinity College in Dublin, Ireland. It was first established in 2004. They approached us inquiring about the research work that we've done with our employer partners and Impact 21's employer engagement tool as well. So like the university in Chile, both these universities have many years of experience providing training to individuals with intellectual disabilities in a higher education setting. They are also working with families, with the larger community, and with employers. So we are all quite eager to draw on our shared experiences, to work together, to learn with and from each other, and to also make positive changes wherever we can do so. Thank you.
Thank you, Denise, and your work's outstanding, and the team you work with the education research team is excellent. So thank you, Denise, from Melbourne.
Thank you.
I think that's the end, Louise, of the theme People in Industry for Impact.
It is indeed. So I can't believe we're up to our last theme.
Yes.
And can you introduce it for us, please, Justin?
It's an absolute pleasure. The fourth theme is Societies in Drastic Change. We all know change is now constant and now part of all our lives. Every day of our life we have to deal with change. Perhaps more than ever before, the pace of change is hectic. Our global complex challenges pose huge risks for social structure and our future. Our search in this theme shows where research that matters as it helps to develop preparedness for dramatic social change.
It's a really important topic. Yeah, and it's great that it's our last topic. I feel like we're going to end with a really powerful, bang.
Excuse me, I know we are.
Yeah, that's right. So I am going to introduce our next presenter, Dr. Madalyn Scerri. Madalyn is from the Blue Mountains, and she applies really unique and special hospitality knowledge across a range of different settings, including aged care, peer-to-peer accommodation, healthcare, for example. Today, Madalyn is going to share one of her most recent projects, which I'm sure everyone will be really interested in because it's about an event that occurred very recently, the 2019-2020 bushfires. And Madalyn has been working with local hospitality and tourism and small businesses around how to become better prepared for future disasters such as these recent bushfires. So thank you, Madalyn. I can't wait to hear from you.
I remember the day before my birthday, December 2019, so clearly, and not because we had a big party. Instead, my husband and I packed our car and we evacuated our newly built home. We hoped it would still be there when we returned. However, the day had been officially declared catastrophic. This is a rating that says there are severely dangerous conditions and that fire activity is likely to increase. There was already bushfire surrounding our part of the town in the Upper Blue Mountains. By that evening, emergency services would be fighting the fire less than 15 metres from our boundary. Days later, my research colleagues Reka and Tom too would evacuate, this time from raging fires on the New South Wales South Coast. Hi, I'm part of a team of hospitality researchers in the Centre for Organisational Change and Agility. I'm going to tell you about our research on bushfire disaster management, but first let's start with why this is critical. Every year in Australia, natural disasters devastate our communities. This last bushfire season was the worst in Australian history, and the impacts are still being felt today. The bushfires were disastrous for many regions of New South Wales who rely on tourism and hospitality. Visitors stopped coming. In some areas, those who did travel were forced to leave as emergency level fires threatened at the height of summer holidays. The people who lived there were told help might not come. Resources were stretched too thin. Since then, more disaster has struck. Severe storms, gale force winds, flooding from heavy rainfall. Of course, bushfire affected businesses are now faced with COVID-19. Some won't recover, including those in hospitality. When these businesses close, we lose meaningful spaces where people can connect. When we're talking small business, families are impacted. The ripple effect goes on. So what do? We know proactive and informed disaster management is critical. With effective strategies, businesses can reduce disruption and recover more effectively. However, studies show tourism and hospitality businesses are often not adequately prepared for disaster. Small to medium businesses are particularly vulnerable as they may lack resources and capabilities, but they are also resilient and responsive to change. What we need now is a better understanding. How do small to medium businesses engage with disaster management in tourism and hospitality? The question also remains, how can businesses come up with new or improved ways of planning if they're still recovering from disaster? Solving this problem requires a multidisciplinary approach. Strategic business planning shows us how important proactive planning is. We also need to be industry focused to connect with the lived experiences of business owners and managers. This is where our research fits in. Our current study at the Centre for Organisational Change and Agility uses a multiple case methodology. We're exploring tourism and hospitality operators' experiences of managing the 2019 to 2020 bushfire disaster. Because there aren't many studies on this, we're focusing on small to medium businesses and looking at 2 affected regions in Australia. We'll look at the impact of the disaster and how the businesses planned for, responded to, and recovered from the event. We want to take a critical look at the lessons learned. In doing so, we can inspire new or improved disaster management activities and then communicate them widely to businesses in bushfire-prone areas. We're taking a 2-pronged approach, and we've just started data collection. This is the really exciting part of research. We're analysing social media as a way of understanding how businesses communicated to customers before, during, and after the disaster event. We're also going to interview businesses to hear their testimonials. Participants' photographs of the disasters will give a unique lens to reflect on and then share businesses' experiences. As disaster management can't be a one-size-fits-all, we'll connect the data to suggest a range of strategies hospitality businesses can adopt or adapt for the future. We'll incorporate graphic design to make this knowledge relatable and compelling and increase uptake. A call out to the design team here for a potential collaboration on this. As a research team, our personal experiences have driven us to tell the stories of businesses who were impacted by the disastrous bushfire season. Their stories and reflections are so important. This information informs the way forward. It will help with many other small businesses before they are confronted with disaster. Their experiences cannot be forgotten or overlooked as more disaster strikes. This research will produce timely knowledge for tourism and hospitality. will gain an enriched understanding of proactive disaster management, useful to many different disaster events and sectors. As a participant and business owner recently told me, anything that can be learnt from our experience can only benefit everyone.
Thanks, Maddie, and thank you very much from the Blue Mountains. A fantastic presentation. We're incredibly proud of the Blue Mountains International School based in the Blue Mountains, which you're very much part of. But just let's push you a bit further outside of the Blue Mountains and work out how your research, understanding the local context and the effect of bushfires, can influence the global community as it responds to climate change. That's the beauty of your research, Maddie. So just unlock that or unpack that for a minute so for us. That'd be fantastic.
Thanks, Justin. This is a really interesting question and point. As researchers, it's true that we have a valuable opportunity to address many of the major challenges that face our society. We can contribute meaningfully to global conversations and also shared agendas for change. We can support local communities and economies, and these are the people who feel the impact of global issues on a local scale. But this means research should connect with calls to action that go beyond national boundaries, such as the Sustainable Development Goals. We can also work together to build a global body of knowledge focused on these shared issues. For example, there are bushfire disaster management research that spans Canada, Europe, America, and Australia too. But like you say, it's also vital to connect these global issues with the local experience, especially since the climate crisis means natural disasters are going to increase in severity and frequency. A local approach prompts tangible solutions that are responsive to the needs of local communities. Together, an approach like this connects local and global issues and makes a difference where and when it counts.
Thank you, Maddie. I love this theme of interconnection that I feel has been like flowing through all of the presentations today. And I have a question for you around that idea of interconnection. We know that you've been doing research using hospitality concepts, for example, in different contexts, such as aged care. Can you tell us a little bit about your experience of bridging across disciplinary boundaries, how that has improved your research and really puts you in a better position to be able to solve these global complex challenges?
Yeah, thanks, Louise. Absolutely. Bridging disciplinary boundaries is so important to give fresh and multiple perspectives to problems. I've always strongly felt that hospitality knowledge has so much to offer other disciplines who provide alternative forms of customer service. Hospitality service excellence puts the experience of the customer first. It strives for service quality at every point. Because of this, there is a growing recognition of the value of hospitality for aged care. This opens up opportunities for health providers to benefit from hospitality-based concepts. An approach like this also helps us to address what's going on in society, such as the recent Royal Commission, which raised concerns regarding the treatment of residents in aged care. But, as we know, more and more people are going to spend their final years in aged care due to an ageing population. Because of this, in one of our studies, Reka Presbury and I are applying a framework of hospitality service language from my PhD to aged care. By looking through the lens of hospitality service, we're in a unique position to connect hospitable service delivery with high quality, empathetic healthcare. And it's particularly timely in the current context of aged care reform.
Thanks, Maddie, and very much thanks, Madalyn Scerri, based in the Blue Mountains, for your excellent presentation, a research fellow who has been talking to us today.
I think we're up to our last presenter. Have we really powered through them? It's amazing.
It's fantastic, and we're just about, before we do that, just to let people know, there's about 7 or 8 people from about 7 or 8 countries across the globe listening to us today, which is fantastic. So it really is the research that matters, that picks up the global trends which has recurred, much as the interconnectedness has recurred, which Louise has talked about. Our last presenter today is Associate Professor Ali Muratjali. Ali is well known to all of us, internationally recognised for his advances in nature-inspired artificial intelligence techniques. He's got this incredible ability to develop general purpose problem-solving and optimization algorithms by mathematically modelling and simulating such natural principles in computers to solve some of the most challenging problems we face in our current century. And that's the complexity of the topic that I just had to read out, Louise. So all over to you, really.
Yeah, I think Ali, and I don't know very much about this either, but I think Ali also looks at machine learning, which is around, I guess, how we can teach computers to think like humans. So that sounds fun. So let's hear from Ali now.
Have you ever wondered who has been the best problem solver in the history? If not, let's think about it a little bit. Is it Archimedes? Is it Galileo? Is it Tesla? Or even is it Albert Einstein? Well, surprisingly, the answer is none of them. To me, the best problem solver in the history is the Mother Nature. And if you wonder why, the next time that you go hiking, look around yourself a bit more carefully. You can find the best solutions for the problems that natural organisms face in nature. For instance, snakes develop venom to kill their prey instantly because they don't have legs to chase them. Birds develop feathers to be able to fly and avoid predator and better find food. Ants, bees, or termites build and create colonies to survive because each individual is smart and not intelligent enough to survive by its own. And even if looking at the trees and plants, they've been adapted in the most perfect manner to cope with environmental challenges, lack of light, lack of water, lack of nutrition, and so on. So in nature, when there is a problem, the Mother Nature has a solution built over millions or even billions of years. This is exactly where my research area, artificial intelligence, comes into play. In this field of study, we mimic and simulate natural intelligence and problem solving in a computer and as a computer program to be able to solve our own problems and tackle our own challenges. Instead of wasting years and years and to develop something from scratch, we simply look at the nature inspired, which is definitely a very wise thing to do. And of course, this doesn't come easy. There are so many mysteries and unknowns about natural organisms, and humankind has not been able to fully mimic and simulate intelligence in a computer. And I'm sure, well, AI is a very broad field of study, and I'm sure you've heard about it lately in your area. Whether you are doing research or whether you are working in industry, you've heard that people started to leverage on the strength of AI techniques and AI algorithms. I've been working in two subfields of AI called swarm intelligence and machine learning techniques. In swarm intelligence, I'll look into the nature and see how collective mechanisms or collective intelligence will lead to a problem, will lead to a solution to a problem. For instance, at the Torrens University in the Center for Artificial Intelligence Research and Optimization, one of the case studies that we focus on is supply chain optimization. We help companies and organizations to find optimal routing paths for the vehicles in the supply chain to minimize fuel consumption, minimize cost, and maximize. How do we do that? We don't build something from scratch. We see how nature solves similar problems. For example, it's been proved that ants are able to find the shortest path from multiple sources of food all the way back to their nest. So they follow an algorithm, okay, collectively. So we inspire from that kind of intelligence and develop an algorithm and apply it to a problem with a much, much bigger scale. So in machine learning, the second area of my research, the inspiration is our brains, the biological neurons in our brains. We as humans constantly learn from experience. We learn how to ride a bike, we learn how to drive a car, we learn how to write something, we learn how to draw something. So we constantly learn, whether supervised or unsupervised. In this field of study, machine learning, I develop mathematical models, computer programs, and algorithms to mimic the same learning process, which means we build an algorithm, we get the machine to learn by experience, by trial and error, to minimize human intervention. And of course, this makes problem solving much, much easier. We don't have to teach computer what to do. That's a computer who teaches itself. And of course, this area has a wide range of application, things like safe driving car, face detection, natural language processing, and so on. We are in the very excited era that will set up for a bright future in which intelligent computers will make our life much easier, much faster, more efficient, and more reliable. At Torrens University, Australia, we are very glad to be a part of this journey. Thanks a lot.
Thanks, Ali, and it's lovely to have you here from Brisbane, so thank you very much. Fantastic presentation and really quite brilliant research. I'm just really interested in where your love affair with Mother Nature began. You've used that as you started your talk, you've used it a couple of times with me. Just where did it begin? Where did that sort of insight come from, Ali?
Thanks, Justin, for the question. Well, the story goes back to many years ago when I was a child. My childhood was around two things: my dad's computer, which you will probably remember from my storytelling event, and a small park near our house. I spent half a day playing computer games and the rest of it going outside, hunting and chasing butterflies, ants, dragonflies, and any sort of creature that I could find at the park. Okay, so for many years, I had two questions at the back of my mind. One, how does a computer work? And two, how does the nature works? Well, those two questions are still my questions. Over the years, I managed to learn a little bit how a computer works and become a programmer, but I still yet to understand how the Mother Nature solves problems in the most perfect manner. So in my research, as I mentioned in the video, I look at nature through the lens of a computer and a computer program. So my relationship with Mother Nature has been always a sort of mentee and mentor. So when I face a problem, I bring it on the table, I think about it, I develop it in my mind, and I rely on her advice. Because if you think about it, there is no more experienced mentor than the nature itself. And why do I keep my open and inspire? Well, because Mother Nature doesn't talk. So I have to think about the problem for days and days, for even weeks, develop it in my mind, and suddenly out of nowhere, I can come up with a solution.
Thanks so much, Ali. I love hearing you talk about Mother Nature like that. My question, though, is around artificial intelligence. Even though your work is inspired by nature, sometimes we get quite scared and there's quite negative images around artificial intelligence. For example, evil robots taking over the world, that kind of image. I also know that you are a big believer in open source algorithms. So you share all of your research widely. How do you make sure as a researcher that, or how do you feel about this idea of everyone being able to access your research and hopefully use it in a safe way?
Well, thanks, Louise. This is a very good question, and probably this is the most frequently asked question of all time for me. Right? And you are absolutely right. A lot of people are intimidated by this new technology. They think they're going to lose their jobs or even their lives to AI. To me, AI is not different from all the technologies that we've developed and discovered in the history. Don't you think people had the same feeling, when the steam engine was invented? Don't you think they had the same feeling during the Industrial Revolution? Well, this is the feeling that we get when it comes to any sort of new technology. So I'll look at AI, and that's a good concern to have, because it will push us to focus not only on the technological aspect of that AI in this case, but also a lot of other things, and ensure the positive impact of that new technology on the society. So I look at AI as a double-edged sword. As I mentioned just now in the video, AI has the potential to make our life much cheaper, more efficient, more reliable. Okay, but of course, it has its own, threats as well. It can be far more devastating than a nuclear weapon. Okay, So the question that goes back to your question, how do we control this? How do we ensure that people use it in a safe way? Well, just like any other technology, we need regulation around it, which is already happening. Research institution, even government started to heavily invest on, things around AI, ethics, regulation, privacy issues, and so on. So those are the sort of areas that we also work at Torrens University, Australia, and we are very proud of it. Those are essential, to minimize the negative, aspect of AI. In regards to my algorithm, as you said, I'm a big believer. I'm a big fan of open source software. But whenever I release my code as a part of my license, I limit some sort of applications which might be a bit dangerous. So that the only way that I've been able to, limit the use of, my algorithm in those areas are through licensing, which we're still working on it and making those licenses better and better every day.
Thanks, Ali. Thank you very much. And we'll leave you and let you go to your life in Brisbane. So thank you very much. That was fantastic.
Thank you, Bob.
That brings us to the end of what's been an extraordinary celebration. 10 outstanding researchers with many and varied topics across all the verticals across Australia and New Zealand. And I hope you take away the absolute passion, the importance of teams, the value of the global connection, and the importance of building research, knowledge and evidence in areas that matter for people's lives. As research teams across the university and across the Think and Media Design School, we'll continue to build our story, build our knowledge base and our evidence base, and drive it forward, whether it be in curriculum, or whether it be back into the community, in policy, but in all the 4 areas. Louise, it's been an extraordinary celebration. We are very proud.
I know. I'm just so pleased that we could bring these presentations and share them with everyone today. I am just going to quickly do a quick plug, and that is please watch out for the stories that are going to be coming out this week in the Daily Shout, where we'll be giving some more extra information about our presenters, and also a plug for a report that's coming out from our very own FIDO. It's about young people and children and access to internet. So I believe it's really quite an interesting report. So that's coming out this weekend.
Thanks, Louise. And before I hand over to Alwyn to wrap it up for us, I just want to acknowledge Bryce's team, Clement, Julia, who really have made this come to life. The videos, the work they've done, it's been an absolute pleasure to work in partnership. And when you run such a beautiful, and there are people with us today as well, we just love the partnership between the researchers and the communicators and the internal people we work with. It's been a really lovely celebration. So Alwyn, over to you, my friend, all yours.
Thank you very much, Justin. Research is our project. It is a Torrens project. It is not the project and the initiative of a few people. And for that reason, the participation of everyone this afternoon is very exciting. We're excited about the number of people that participate today and listen to this and engage. And we do believe that through this, more and more people will be mobilized to become as excited about the research as we are. If we look at the 4th Industrial Revolution and we see the whole idea of the physical, the biological, and the digital integrating, at the bottom of all of that sits the enabling capacity of human beings, people that must drive the technology and that enable the technology, and that technology becomes enabling to them again. And you would have heard this afternoon the strong people orientation, the strong foundation that we have in terms of optimizing human systems, supporting people to enable them to become more effective and engage more effectively and supporting each other more effectively. So where are we going with our research? Firstly, we need to broaden the base. We need to make sure that research becomes a day-to-day activity in the normal lives of people. It must be a way of practice in the institution. So we need to do that. Secondly, we need to make sure that we place our research and our researchers within the context of the quadruple helix. That means that we must put our researchers in the innovative space. And that space is defined by our relationships with industry, with government, with other academic institutions, and critically important, with community. So sitting in this space, we can identify the relevance of what we do. We can find a base from where what we do can be legitimized. Therefore, it becomes innovation, and that innovation has the potential for technology. Therefore, that goes out into society to influence the lives of people. And this is how we achieve impact through our research. So what is exciting is that on this basis, we will continue to strengthen the research teaching nexus. In other words, get our curriculum informed by the research. Through that, our academics become practitioners. In other words, our academics become scholars in the sense that they apply what they study, what they learn, back into the curriculum, into the teaching process. And we want to see that scholarship informing. So if we work in terms of our internal system and we extend it into our external system, we create synergy with more capacity. We release more resources into this process, which multiply the impact that we can have in society. So the exciting part is, if we talk about research that matters, the question is, matters what or matters whom? And you've heard today, does it matter people? Does it matter development at large? The Sustainable Development Goals? What is it that we want to matter? The principle is that we want to impact society. And we're going to refine this concept about matters what through our research and through our thinking. Because in the end, we want the society to understand that we are reliable partners in creating new knowledge, finding new solutions, and collaborating with them in partnership, sharing knowledge with our communities and our industry and our government and our other universities towards better solutions in the improvement of human well-being. Thank you very much for participating. Thank you very much, Bryce and Justin and Louise and all our colleagues here supporting us today. This is a phenomenal event, and I'm excited about the fact of growing this and making it bigger, but also engage more people in the discussion so that research becomes a way of living. Thank you very much.
Thank you, Alwyn. To finish, I just want to acknowledge one of my dearest colleagues, Alex, who's not with us today. There is a deep sadness across the whole university, across Think and Media Design School and the business vertical, and to acknowledge Alex's input with his research and his academic life for us as a university. Thank you, Alex. God loving, God willing, and we will miss you very much as we go forward. I want to finish. I want to thank everyone for being part of this absolutely brilliant couple of hours. It's been a pleasure to be here. Thank you very much. There will be another one in the future as we move forward with a further 10 researchers into the thing, but it's been an absolute pleasure for Louise and I and Alwyn to present, to engage and to talk to people right across Australia and New Zealand. Have a lovely day and a lovely night as we go forward. Thank you very much.